Hi, I'm Marissa. I chose to include occupational therapy, or OT, into my Psychology is Weird project to deepen my learning as I plan to pursue this career. According to the American Occupational Therapy Association, occupational therapy intervention uses everyday life activities or occupations to promote health, well being, and your ability to participate in important activities in your life. These occupations are any meaningful activities a person wants or needs to accomplish. Because children are so dependent on their parents or caregivers, pediatric occupational therapy can look a little different. The plan was to research the role parents or caregivers play in a child's occupational therapy intervention. However, as I was researching, I found that the topic was too specific. So I broadened my search to include early intervention as a whole. Early intervention is an umbrella term used to describe services and supports available to babies and young children with developmental delays and disabilities and their families. Early intervention benefits the patient, but it also supports their families. It can have a significant impact on the child's ability to learn new skills and increase their success in school and life. These services are most effective earlier in life because of the adaptability and plasticity of the child's brain. Additionally, intervention helps the families learn how to best support their child's needs, establishing a safe and supportive environment for all of them. My weird article came from a convenient sample of caregivers receiving OT services from a specific doctor at an outpatient clinic in the UMass Memorial Health Department of Psychiatry, specializing in diagnosing and treating neurodevelopmental disorders such as autism spectrum disorder, ADHD, and learning or intellectual disabilities. The sample included 8 participants, all parents of the child receiving occupational therapy. The entire sample spoke English, and there were varying levels of education, from a high school diploma to a doctorate degree. 3 of 8 of the parents were of Hispanic or Latinx ethnicity. Qualitative data was collected during 2 recorded focus groups in which the facilitator asked broad, probing questions following a semi structured script. Following analysis of the data, the researchers developed 4 overarching themes. It's a family affair, sometimes it just takes a bit of training, using OT strategies to the full extent, and it's definitely better to be in the session. The results indicated that the parents gained invaluable knowledge by being included in the therapy session. They were better able to understand and communicate with their child and implement these practices in their daily lives. The researchers concluded that the inclusion of parents in OT sessions enhances both parent and child outcomes. In my non weird article, participants were recruited from 6 early intervention agencies in Wuhan, Hubei Province, China. 37 practitioners responded, all with a college degree or higher. Practitioners shared perceptions in focus groups following a presentation about family centered practice being considered the best practice for early intervention practitioners. 4 themes were identified, 1 in support of family centered practice, and 3 addressing barriers. Despite support for family centered practice, practitioners recognized how China's traditional values pose obstacles. They face parents who are less willing to collaborate and participate in their child's therapy. Parents struggle with the unfamiliarity of questioning and collaborating with the practitioners who are traditionally seen as the experts. However, parents are the experts when it comes to their own children. One of the major obstacles is this undefined and culturally influenced balance of power. The practitioners know a social negativity towards individuals with delays and disabilities. Children who need occupational therapy are not welcomed or valued the same way healthy children are. Additionally, early intervention services in China do not have access to the financial and human resources necessary to implement a stronger family centered practice. Most practitioners agreed with the philosophies of family centered practice and believe that there is potential for future implementation, but child centered services will continue to play a dominant role. Both of the weird and non weird studies note the importance of integrating families into early intervention therapies. It is the cultural norms that seem to make the difference. While family centered practice is typical in the United States and preferred by parents, as seen in the Weird article, traditional values and resources hinder the same practice in China. That's all. Thanks so much. So I can't get my face to stop covering the references, but here's my reference page.